I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital, and this is Live Well Talk on COVID-19. We're going to start this week with an update, and then I'm going to go through the 10 things that I've learned from COVID during the pandemic or related topics. And then we'll finish with an episode of the Mailbag. What we're seeing in the hospital in the last couple of weeks is the numbers slowly coming down. I think I've mentioned previously that we were in the 50s, drifting up to the 60s, and we may have even hit 70 at one point. Now we're down to the 30s as far as COVID patients. Couple things that look really good. The cases in the county have started to come down very slowly, but they are coming down. So that means the people in the susceptible bucket, infected bucket, recovered bucket, people are leaving the infected bucket faster than people are coming into it. So that's a good thing. One trend that we have seen reverse is it was about a 85 to 90% of the patients were unvaccinated in the hospital and in the ICU, a little bit higher percentage in the ICU. And that has changed a little bit to 70-30. And we've seen that over the last 2 weeks, that gradual change. And so has UnityPoint Health, the whole system, because we do get that report. And that is different, obviously. We observed that. And it's one of two things. It is that the vaccines are wearing off on patients, and then they're susceptible, or the vaccines don't protect you significantly against Omicron. Now, there has been, I don't remember where I read it, but the booster does appear to have some protection as far as decreasing hospitalization. I don't remember the statistics in that study or the size of people or how they calculated that, so that's yet to be seen. Also, in the last week, Moderna has received full FDA approval to join Pfizer as an approved, not authorized, but approved vaccine. Linn County remains on high transmission, and we were 948 cases this week per 100,000, and we were almost 1,200 last week. So that's a reasonable drop, and hopefully that'll keep coming down. That's the end of the COVID-19 update. Now I'd like to go through the 10 things that I've learned during the pandemic, either in the hospital or in my own life. The first is Authorized is not approved. I never had noticed the difference. I was familiar with emergency use, but I never noticed that Authorized and approved were two different things. And I think we sometimes use those terms interchangeably, and they're actually different. And that was something I didn't know. I've also learned that there's such thing as blueprints and there's scrambles. And during the pandemic, we've had some things that were blueprints where we knew that it was going to happen. We had a previous policy. We executed upon it. And then other things were just a scramble. And some days it seemed like a scramble all day, every day. But if you got a good team around you, those scrambles are pretty easy to execute upon, particularly if you have the guiding principles. And we did have 4 guiding principles: was to protect patients, preserve the healthcare system, reduce spread of the contagion, and to protect our staff. And so if you have those guiding principles, it's easy to create a scramble. And I think multiple times I was pretty proud of how we handled situations as they came at us. The third thing I learned, pangolin. I did not know what a pangolin was. It is a scaly anteater. It is the only mammal with scales, and I had no idea that a pangolin exists, and now I do. The fourth thing I learned, ChickfilA. People love ChickfilA. You may know, some of the listeners may know, my wife Tanya works in the foundation, St. Luke's Foundation. They coordinated food delivery, and so I helped her on multiple occasions deliver in the evenings back to the hospital when local restaurants would donate food, and then we would take it to each unit. And man, Chick-fil-A really made people happy. So if you're going to eat a chicken sandwich, I highly recommend Chick-fil-A. The fifth thing that I learned is we didn't have a hierarchy of recommendations. So when we were going through the pandemic, I think we made the mistake of one category or recommendation we were following was the WHO, the World Health Organization. The next was the CDC. The next was the FDA. The next was what the state said. The next is what maybe the American College of Gynecology, uh, Obstetrics and Gynecology, what they said. And that those disparities were hard to keep track of. And as a medical staff, we would be taking a poll at the end of the pandemic, or in coming months at least, to say, okay, I'm just giving an example, we're a WHO medical staff. And then if the WHO doesn't have an answer for us, we go to the CDC, and then maybe the next, and then maybe it's the colleges and the universities of particular medical specialties that publish papers, etc. So we have a hierarchy of making those decisions rather than having this just chaos of CDC, state, WHO, that it was really confusing. It was hard for people to follow. The sixth thing I learned, number 6, COVID is not influenza. At the beginning of the pandemic, there's a lot of comparison of COVID to influenza, and people were making decisions based upon how influenza behaved, the flu season, etc. It's going to be a bad flu season. You heard those terms thrown around, and I think learning during that COVID it's a different virus. It's different than influenza, and other than it causes a respiratory illness and it's a virus, there's not a lot of similarities between the two. Influenza certainly is more droplet, where I think it's, in my mind, definitive. COVID at times is opportunistically, depending on the right scenario, is actually airborne. And I think that is certainly something I'm taking forward from this, that I'm not going to compare influenza and COVID as I make decisions. The seventh thing I learned, Mother Nature will humble you, and will always win. That we try to predict the virus at times, and you're wrong. You say it's going to do this, you think it's going to do this based upon this, and it just doesn't. And so I think it makes you stay humble, which is always a gift, I guess. But Mother Nature just has a way, obviously, of just moving forward. And I like to tell this story. So next to the hospital is Cargill, and they corn and soybeans come in there, of course. And I believe this is a corn plant. And so one of those trucks going back on 380 to head north, at some point a kernel of corn dropped into the crack in the sidewalk, or excuse me, in the road, and a stalk of corn grew. And I always would drive by that at the end of the day and think, man, just the life force, Mother Nature just goes on, and it's relentless, and it's going to keep going on, and you need to recognize that and respect that. The eighth thing I learned was air circulation is important. Never really thought about air circulation prior to that. I knew that our surgical rooms cycled the air at a greater frequency per hour than the other rooms. Other than that, I really had no idea. And learned a lot, read a lot about air circulation and how that is thought through, and how some of the, in third world countries or the tropics, how they built hospitals was so they had good air circulation and air movement. Stagnant air is concerning because that may allow the virus to be suspended longer and then subsequently increase the transmission. The ninth thing I learned is have early interventions. You know, early on we waited until people were low on oxygen before we put them in the hospital, and we didn't have early therapeutics at our disposal. And I've learned that that's something that's very important. And even if we have to do it locally to put together a protocol, but we should do a better job putting together a protocol earlier. The guidelines for treatment weren't published until October 2020, and so that was well into the pandemic. And fortunately, they were published prior to that peak that we had in November into December of 2020. But it felt like they came late, and it felt like with the power of our academic medical institutions and our private hospitals and medical institutions, we should have had a protocol for treatment earlier than what we did. Um, and the 10th thing that I learned and unfortunately observed to be true is routine healthcare is important. When we had the lockdowns, we suspended routine healthcare. And uh, that contact with your clinician that takes care of you and the specialists that take care of you, it is important. And when you suspend it like that, um, it it causes a tsunami effect that comes later as diabetes and cancer and heart disease. Those all continue to progress, and it just lands in your lap someday. And that's one of the reasons why I've been so busy. And so routine healthcare is important. And if I wouldn't make that mistake again, I would keep things open and keep moving along with routine healthcare and maintenance healthcare, particularly diagnostics to screen for cancer and heart disease. That was the 10 things I've learned. I've learned other things, but those are the 10 that I felt the most perhaps unique, but certainly worthy of learning and knowing about them and going forward. You notice I didn't make any reference to healthcare workers are really superheroes, and because I didn't learn that, I already knew that. The pandemic just revealed to me or confirmed to me what I've always known, that nurses, respiratory therapists, physicians, techs, laboratory personnel, radiology personnel, they're dedicated and they go above and beyond every day, regardless of the circumstances, to get the job done. And I'm very thankful. I work with a tremendously good team, and we'll be ready for the next pandemic, but we'll also finish out this pandemic strong. That's the end of the COVID update and my top 10 things that I've learned. Stick around and we'll be right back with an episode of the Mailbag. Welcome to the Mailbag. This is an opportunity for me to respond to listeners' questions that are submitted. And they are on COVID trending topics. This week, all three of them are related to COVID, and they're actually excellent questions. The first question is from Sarah. How many more previously healthy people have had blood clots, strokes, heart attacks after taking the COVID shots and boosters? What's that compared to maybe 2 years ago? Well, we do know for myocarditis that observational studies, passively, meaning we're just looking at charts, we're looking at results, we don't have a control group, it's observational, shows that there is an increase in cases of myocarditis. We will not have the stroke data probably for another year or two, because that doesn't come out just like every year. They might give a raw number every year, but I don't think you can make a comparison. Certainly prior to the pandemic, 2015 was I remember reading that we were trending down in strokes, that we were doing a better job of taking care of them, and the deaths from strokes were declining. But myocarditis, there's more myocarditis because attributed to that vaccine, perhaps. That's what it's felt to be, and it's seen in younger men, late teens, early 20s. It is interesting, though, the course of those myocarditis. Usually viral myocarditis is kind of an indolent, slowly progressive. The patient gets worse and presents, and you make the diagnosis. The ones associated with the vaccine spike a couple days after they got the vaccine, and tends to fortunately get better quickly. And so over time, we will see how it influenced strokes and heart attacks, of course. But then there'll always be that question, was that related to the vaccines, or was that because we suspended maintenance health care there for a while? So great question, and we'll continue to monitor that. The next question is from Sharon. If an immunocompromised, meaning the person doesn't have an immune system that functions as it should, over 70, has a mild breakthrough case and receives monoclonal antibodies 5 months after having received the third Pfizer dose, when would they be considered for a fourth dose? If they're immunocompromised, that fourth dose it may be beneficial. I've actually read that in a couple just from the AMA and some of the morning emails that come in with news articles, but it would be 90 days. So from the monoclonal antibody, you'd want to wait 90 days before you gave the booster, because you're receiving the booster, and so that would be the recommendation, to wait 90 days. Our last question is from Kelly. As the rate of hospitalizations are going up, is there a breakdown for vaccinated and those with and without a booster? Yes, there is. Then following them. So as I said in the update, that 70% of the hospitalizations are unvaccinated, 30% vaccinated. Of that 30%, there does appear to be some efficacy or some additional protection with the booster, keeping the patients out of the intensive care unit. So if you have the booster, you have a reduced possibility of going to the intensive care unit as opposed to the medical surgical floor. Some of the patients that I've seen in the hospital and taken care of personally that they've received the booster, they had a lot of chronic medical conditions to begin with, and whether or not that contributed to them being hospitalized with the COVID-19 breakthrough case, I think that's the jury's out on that, how that worked, but definitely the booster does provide some protection, and maybe even to a certain degree of Omicron. At least Pfizer has looked at that, and it may prevent patients from being in the intensive care unit. Great questions. And that's all for the mailbag. If you'd like to submit a question to the mailbag, go to unitypoint.org/mailbag. I'll answer questions about COVID-19, latest technologies, follow up on a previous podcast, follow up on an update. Always happy to answer questions about services that we're providing here at St. Luke's that I'm quite proud of. Any questions about personal symptoms or conditions need to be taken to your family clinician. If it's an emergency, go to the emergency room or dial 911 if no emergency room is nearby. Once again, you can submit your questions to me at unitypoint.org/mailbag. That's unitypoint.org/mailbag. I look forward to hearing from you, our amazing listeners. Thank you for listening to COVID-19 Update. For the latest on COVID-19, vaccine information, and more, visit unitypoint.org.
Thank you for listening to Live Well Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.